In the last year, has our economic activity been affected more by fear of catching COVID or the stringency of a lockdown? Hello, Colombe. Welcome.
Hi, Tim.
Now, Colombe, for the last year on Vox Talks, we've been investigating the impact of lockdowns of mobility on COVID deaths. You're doing something different here. This is the impact of lockdown and deaths on mobility, isn't it? Why the difference?
So the type of studies you're mentioning, they're trying to assess the epidemiological efficiency of lockdowns, meaning whether the lockdowns reduce COVID infections and deaths. And in our study, we're trying to assess the economic impact of COVID and whether it comes more from government restrictions or fears of COVID infections. So to do so, we use the mobility as a proxy variable for the economic activity. And we find in our study that there is a positive correlation between mobility and GDP, which was about 60% over the first 3 quarters of 2020.
And to do that, you're using the Google mobility data, aren't you? How good is this data? How many countries do you have it for?
So yes, we use the Google mobility data because it's high frequency, it's daily, and the data is public. We cover 29 countries in our analysis. We look at advanced OECD countries, but they have a lot more countries available in their database.
What I'm calling lockdowns is, more specifically in the paper, you call them non-pharmaceutical interventions, NPIs, aren't you? Is this the Oxford Index that we hear so much about the stringency of these lockdowns, of these restrictions?
Yes. So we use the data from the University of Oxford, and they've been publishing really this amazing data since the beginning of the crisis. And in particular, they constructed this stringency index, which measures the number of non-pharmaceutical interventions that are in place in a country, and also how strict they are. So this index, it doesn't actually only measure the stringency of lockdowns, but the stringency of mobility restrictions more broadly.
See, now also you have to pick some statistic that's going to measure COVID-19 deaths, don't you? Which statistic did you pick and why did you choose that?
Yes, so we use the daily COVID death per million inhabitants, and we source it from Johns Hopkins University, which has been widely used since the beginning of the crisis. And this variable, it's a way to measure the state of the health situation in a country at time t, and it enables us to see how much people restrict their mobility as a result of the sanitary situation.
Now, you mentioned earlier on about the Google data, that there's an advantage in it. It's high-frequency data. You get something from that every day. For the deaths data, you get that every day as well. Is there an advantage in having this sort of high-frequency data?
There is, for several reasons. The first thing is that things have been happening really quickly, and it was really important to be able to do an assessment of the economic impact of the measures relatively rapidly. So using high-frequency data, it enables us to do so before the publication of official statistics, such as GDP figures, which usually take time to estimate. And then there's also a second reason, which is that GDP figures are usually published at a quarterly level. So this is not, let's say, granular enough to be able to estimate the impact of specific policies that are implemented and then changed at a relatively high frequency, sometimes daily. So if I give you an example, in our paper, on average, in our samples, you have 24 hours that separates the implementation of a stay-at-home order from restrictions on internal movements. So if we were to try to measure the relative impact of each measure with quarterly data, we wouldn't be able to do so.
So you have the impact of the number of deaths that people are perceiving, and you have the impact of these NPIs, the lockdowns, on economic activity. What is it? How big is it?
So so over the whole period of our sample, which spans from the 15th of February 2020 to the 15th of January 2021, we see that an increase of the stringency index, so of the non-pharmaceutical interventions, of 10 percentage points is associated with a decrease in mobility of 4 percentage points. So this stringency index is from 0 to 100, And so in order to see how big the impact is, we compare it to the standard deviation of the stringency index, and it's 24%. So we can say that the impact is relatively big because it means that an average increase in the stringency index entails a mobility reduction close to 10 percentage points. In parallel, we're looking at the increase of COVID deaths and how this has an impact on mobility. And so we see that an increase of 1 death per 1 million inhabitants is associated with a mobility decline of 0.9 percentage point. So let's say 1 percentage point. Here, the standard deviation of our variable is 4 COVID deaths per million. So the effect is less important, but still significant. And it means that an average increase in the number of daily COVID deaths appears to lead to a decline in mobility of 4 percentage points.
The data that you have, though, covers quite a long time period, doesn't it? And really 2 periods during which these interventions were in place, weren't they, in the countries that you're looking at? Does the relative importance of the number of deaths and the interventions, the lockdowns, does that relative importance change between these 2 lockdowns?
Yes, they do. So what we find is that during the first wave of COVID, the mobility reduction comes primarily from government restrictions and by a long margin. So if we look at the second wave, the impact of government restrictions is less important, and the effect attributable to daily deaths gains weight, and it actually almost reaches the level of government restrictions. So in a way, what this tells us is that on average, the government restrictions, they were less severe during the second COVID wave. And in parallel, the effect of voluntary social distancing on mobility, it increased. So it could mean that when restrictions are less severe, people are given more room to behave like good citizens or are more afraid of COVID infections because the state is less present, and they're more likely to reduce their mobility voluntarily.
And as you say, not all countries' restrictions were the same, and you can pick out the differences in this Oxford data, can't you? Do you know from what you did the different effects of different NPIs on mobility?
Yes. So we look at 2 things in the paper. The first one, we look at what type of NPI has more effect. And there we find that workplace closures and school closures, they seem to be the most efficient measures at reducing mobility. And this applies both to the first wave and second wave. We also find that stay-at-home orders were efficient during the first wave, but not the second wave. But this effect, it could be this lack of effect, it could also be partly due to lower statistical power during the second wave because less countries implemented stay-at-home orders. Then the second thing that we look at is whether the degree of stringency had an effect. So if you implement a measure that is more stringent, does it have more an effect? Is it more effective at reducing mobility? So, for example, we compare a workplace closure. We compare a workplace closure of level 3, which means that everything is closed except from essential businesses, to a workplace closure of level 1, where teleworking is only recommended by the government. And here we see that the more stringent measure has a higher elasticity. So it suggests that there is some kind of non-linearity going on there. But I just want to highlight, and we highlight it in the paper, that we're very cautious about these results because the sequencing of the implementation of the measures was very, very quick. So as you know, most of the time it wasn't just one restriction being implemented, but a bundle of restrictions implemented at the same time. And so it makes it hard to estimate the difference of impact from one measure to the other one because the window of implementation was very short.
Do we know enough, Colombe, to look forward from what you've managed to find out so far? Because we all assume that there will be another pandemic, another wave of this pandemic perhaps, and there will be some new measures to restrict us in our homes and we will experience deaths again. Do we know how we're likely to react in the future?
So I would say that one thing we see from our paper is that voluntary social distancing plays a bigger role when the government restrictions are less stringent. And that's what we see in the second wave. So it seems to mean that there is a learning curve, so it took time for people to learn how to behave under COVID, or when people are given more room to decide for themselves, they actually, a number of them actually choose to reduce their movements voluntarily. So we would need to estimate the other side, which is the epidemiological impact of these two variables. But potentially, it could mean that there is a better medium-term equilibrium to find between government restrictions and voluntary social distancing should another pandemic take place.
Well, Colombe, it's very interesting, and it's very interesting as well to see how high-frequency data has been taken up so quickly and how it's been so useful in this pandemic. So thank you very much for talking to me about it today.
Thanks to you.
You can read about all the research and the data in more detail in the paper. It's called Fears of COVID and Non-Pharmaceutical Interventions, an analysis of their economic impact among 29 advanced OECD countries. And the authors are Laurence Boone and Colombe Ladreit. It's in COVID Economics 73. Well, thanks for watching again. Remember, you can always find all the up-to-the-minute research into the impact of COVID-19 in COVID Economics. It's free, it's open access, and it's at CEPR.org.